Om. 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 विश्वंभरा वसुधानि प्रतिष्ठा हिरण्यवक्षा जगतो निवेशनी वैश्वानरं बिभ्रती भूमिरग्निम् इन्द्ररषभा द्रविणे दधातु ॐ शान्ति शान्ति शान्तिः.
All to your time.
Good morning to all of you and those who have come for the first time to our meeting. With noble intention of liberating his ancestors, Bhagirath performed intense tapas, ushering the descent of Ganga, the celestial river, onto the earth. The conclusions drawn by the cosmologists on the origin of our own universe, that is Akasha Ganga, the Milky Way, is more intriguing. While Bhagirath performed tapasya, it is said, for thousands of years, Earth reached its present shape and size and volume approximately 4.6 billion years ago, after a very rigorous and violent past, consisting of thousands of years of volcanic eruptions, quakes, rains, and all other calamities. We went through gradual transformation and change to prepare our residence, which is congenial to life, very much like a mother before delivering a child. It is said humans, humans are only about 35 years old, which measures to only 3/10 of a second on the Earth clock. Earth clock is divided into 24 hours from night, that is morning 12 o'clock to the noon 12 o'clock. I mean, next 24 hours. So you see, uh, having taken so much of time to prepare our residence, which was congenial to us, we have tried to not control, but we have also tried to destroy the ecology from just about 350 400 years. This happened after the advent of James Watt, who gave us steam engine. So the rapid changes that are taking place, and the climate change we are experiencing, and the biodiversity which is under threat, is all because of human activities, I say. Vivekanand Kendra, under its Natural Resources Development Project, NARDEP, a wing established in 1986, took a holistic approach to sustainable development, and this was done much before the Sustainable Development Goals, which is given by UN. Vivekanand Kendra has done a lot of work in agriculture, bioenergy, eco-friendly constructions, water, and on the foundation of inner sustainability as enshrined in our culture. Having gained rich experiences in all these years, it was felt that they should take the message of sustainable living to the common mass of people, and by so doing, at least be able to postpone, if not stop, the inevitable catastrophe that looms large on our heads. Unless sustainable lifestyle becomes a mass movement, humanity cannot avert what appears to be the inevitable. While the dark times of the Earth's history are on, signs are also on, like that of dawn before the sunrise, in the form of innumerable individuals who have accepted the minimalistic way of life through their genuine concern, not profit, conviction, not publicity, and total dedication, they are leading lives sustainable to make a difference around them. In past 6 to 7 years, brainstorming sessions with experts on environment and persons living sustainable life have resulted in developing a digital exhibition entitled What We Have. It's not just a display of vital information to those who are unaware of the disaster, or of bringing an awareness that the globe with all its beings, living as well as non-living, are interdependent on other, but more importantly, an appeal to participate in making in helping Mother Earth to help her in reviving in her self revival. Having done most arduous austerity in the forms of change, it forms the life change in lifestyle, and of lending a helping hand to those who have dedicated their lives for the cause. It's an invitation to be an active part of this movement in giving respite to Vasudha from the damage we have afflicted on us. NARDEP is building a network and of such persons who are involved in grand yajna for her. So we invite and welcome Dr. Narendra Nathji for this webinar. Thank you, Sam. We look forward to your sharings. Thank you.
Pranam to all. It has been my pleasure to introduce Dr. Narendra Nath Malhotra ji. Dr. Narendra Nath Malhotra ji has an illustrious career. He holds a master from G.B. Pant University, Pantnagar, and a doctorate in biochemistry from All India Institute of Medical Sciences, New Delhi. Dr. Mehrotra is an avid researcher, has authored over 30 books and reports, and has around 100 research publications to his credit. He has extensively worked for science popularization, was a member of many high-level committees and boards, and served as executive director of Madhya Pradesh Council of Science and Technology. Later, he superannuated as deputy director of the Central Drug Research Institute, Lucknow. There is a long list of his achievements. Current interests include science and technology policy, sustainable development, and Indian system of medicines and medicinal plants. I now invite respected Malhotra ji to enlighten us with his views. Now, floor is yours, Dr. Malhotra, please.
Thank you, Prakash ji. As the screen sharing shows, I will be largely talking about a program that we are running. It's called Mission Ayush Arogyakar, which is an initiative for health self-reliance in rural India. We have been running it for about last 5 years with help from Mission Samriddhi. Now, I would take you to the current context of primary health care, because we are talking about self-reliance in primary health care. The current context of primary health care very clearly shows in this slide. Though about 70% of India, even today, lives in rural areas where facilities for health, like there might be a PHC, a CHC, or a sub-center, but either the physician may not be there, or the medicines may not be there, or even if the physician is posted, he or she may not turn up. So the actual availability of healthcare in rural areas with the help of the Western biomedicine is about 30%. And 70% people don't have access to primary health care from the Western biomedicine system. And the problems are in rural areas, 90% of the problems are simple problems, which are easily manageable, like cough, cold, fever, diarrhea, dysentery, other gastrointestinal diseases, skin, and so on, which a lot of these can be managed at the local level. But unfortunately, 95% of our health budget of the entire country goes to the Western medicine, which provides support only to largely cities and through a system of treatment of diseases. The approach is not for health, the approach is disease management. You should understand this difference. People in the modern system expect you to fall sick so that they can be treated. Hospital in some languages is also mentioned as Rugnalaya, which means only sick people can go there. Healthy people are not supposed to go there. But the concept of our system is the opposite. We believe in, my cursor is not moving. Yeah. With all this situation, a separate ministry of Ayush was set up in 2014, which largely supports these Ayurveda, Yoga, Unani, Siddha, Soarikpa, which is the Tibetan system, and homeopathy. And the strength of these was pretty evident in COVID-19 epidemic. When the use of the guidelines made by Ayush Ministry were followed in most states, and they were more useful in preventing the advent of COVID in a large number of people. There were studies, there is data available. Based on that, the ministry agreed, Government of India, even the Health Ministry agreed to set up health and wellness centers. So about 150,000 health and wellness centers are supposed to be created. But even there, something like 80% are going to be with the Western system. Only about 12,500 will be governed by the Ayush Ministry. The rest 1,35,000-38,000 will be governed by Allopathic Ministry, where a yoga expert or a Ayush expert may be posted as a subservient to the allopathic system people. So the mindset of the government, even if they claim to be favoring the Ayush system, the mindset still is largely covering the allopathic system. Because what matters is the budget. If 95% of budget is governed by one ministry, obviously they will be dominating. But why should we bother about Ayush if they are important, the allopathy is important? Because Ayush systems are largely affordable to people. At the primary healthcare level, they are accessible to people. Both the Ayush as well as local or folk health traditions. The efficacy of the traditional medicine, or what is called as complementary and alternative medicine in the Western paradigm, they can work both in the primary health conditions as well as some chronic conditions like diarrhea, like diabetes or cardiac care or even cancer and all, where palliative care or management on the long run without side effects, and side effects means iatrogenic effects of the allopathy. Iatrogenic effect means the effect of the medicine itself or effect of the health system itself. Large part of the allopathic systems have side effects, which are called iatrogenic effects, whereas most of the Ayush systems don't have side effects. I'm not saying that Ayush systems don't have side effects. They have side effects if not used properly. Whereas in allopathy, the side effects will be there even if you are following it systematically according to physician's prescription. Like whether it is anti-tubercular medicine or whether it is cardiac medicines or diabetic medicines, long-term usage of those medicines is known to have side effects. Whereas in Ayush, like if you do yoga can also have side effects. If you don't do yogasan properly, if you don't do pranayam properly, it can give side effects. But if you are following it properly under the guidance of a physician, Ayush physician or a yogic expert, then side effects won't be there. Please see the difference. If you are doing it under the guidance of expert, The Ayush systems don't have side effects. But even if you do under the guidance of an expert of Western medicine, side effects will be there. That is the basic difference. The other thing is that the modern medicine has limits. Like many conditions, you cannot treat with allopathy. They say, I'm sorry, we don't have a system to take care. Like liver, like many conditions. They say it's very. See, I'm saying this because I have gone through the rigor of the All India Institute of Medical Sciences, Delhi, which used to be and continues to be the most premier institution of Western biomedicine in India. But even there, I realized that the Western medicine has limitations. Whereas, despite ignoring or not allowing Ayush systems or the traditional knowledge systems, they provide much better possibilities. Of course, they talk about changing lifestyles and incompatibility of various practices that you follow in your daily life, which now even Western biomedicine is referring to. They are saying you have to change lifestyle and so on. It has, of course, cultural compatibility of Indian system, whether it is North India, South India, or anywhere in the country. So if we look at some of the facts, there was a study done at what was called National Health Science Resource Center, which is set up at the National Institute of Health and Family Welfare of Government of India. This is a center which was established to do research on health systems. They conducted a study in early 2000 about the status of Ayush or the local traditions in the entire country in the context of public health. They approached all the 24 states and union territories at that time, out of which 18 responded. And they started in 18, but successfully they could complete in about 14 thoroughly. But out of that, if you look at the basic concept that the Ayush or our Ayurveda has, is of Swastha Swastha Rakshanam. Like we focus on preventing or maintaining a healthy life. We don't talk of disease to begin with. They talk of Aturasya Vikara Prashmanam Cha. When we become sick, then we need treatment. But we should focus on healthcare to be remaining healthy. Now, in this concept, the strength of the Ayush and the local traditions in public health, for example, nutrition or preventive care or even curative care and promotive care was largely unused, and which is largely unused even today, despite the experience of COVID. And unfortunately, when I tried to study the Ayush ministry's programs also, they are also unfortunately trying to follow the Western systems approach. They are saying, let's do double-blind, placebo-controlled trials, and once they are approved, then only we will follow our treatments. They are not saying with confidence that our Ayush experience of thousands of years in many health regimens is proven beyond doubt. There are no side effects known. There may be differences between Vaidyas or Siddha Vaidyas or yogic experts in approach to particular asana pranayam. There could be various like Hatha Yoga or PR school of yoga or Iyengar yoga and so on. But basic concept remains the same. So this has to be carefully looked at, and we must use the large storehouse of knowledge that is available across the country. There are so many manuscripts also even there, and involve them in the primary health care. But the even Ayush departments programs of primary health care are very, very limited. I've tried to point it out to even to the Ayush ministry people, but unfortunately, there also their mental lack of strength, I would say, or courage to stand up against the Western uh, paradigm is limiting, which is different, for example, in Chinese system. Chinese system people, historically because of Mao Zedong, could stand up and they strengthened because at one point of time, Mao Zedong said 50% budget of the health of entire China will be given to Chinese medicine. We cannot imagine. We have 95% budget with allopathy. With 5% you keep playing. Where will you have confidence if you don't have money? The minister who's placed there is usually a punishment posting. A IAS officer who's posted there is a punishment posting because it's very small budget. A ministry with 5,000 crore budget or a ministry with 5,000 crore budget, 500,000 crore budget, who will be more important? That is what matters. But this study showed that in 14 of the 18 states where they studies, even as late as in early 2000s, 80 to 100% of the households were reported of using the local health traditions or the Ayush or traditional knowledge system. They were using both in the acute conditions as well as in chronic conditions. But mind you, this study was conducted by an institution like GNU, Department of Community Medicine and Social Health, with the help of the National Resource Center. So they were not very favorable to originally to the traditional knowledge. But when they found what was prevalent in the country, even in early 2000s, was that they were able to manage it, excluding serious emergencies. Serious emergencies, usually Ayush systems don't work. That's where allopathy is important and much more favored. The other fact was that even in states like Tamil Nadu and Kerala, where apparently the Western biomedicine system, the hospital, the dispensaries, is far better in terms of functioning. The medicines are available, doctors are available, they're all there all the time available and provide best services. Even there, common man was using the allopathic and the Ayush and the local traditions. Even there, when they went to the Ayush dispensaries and to the allopathic hospitals, they found that even there, people were going in large numbers to Ayush hospitals or dispensaries. And awareness about the use of medicinal plants existed in from 47% to 100% people in households. And knowledge about food items and medicinal value was there in 54 to 100%. This is based on random sample survey they took in many of these places. A small number, 1,000 people, 500 people. But the community's knowledge was validated, that the community even at that time largely knew what is the advantage of these things, and their knowledge was valid. It was not the erroneous knowledge. And even 70% of the allopathic doctors realized that Ayush systems are not redundant. And they suggested how to improve upon them, how their home remedies were useful. And something like 55% of this survey, allopathic doctors recommended you use Ayurvedic medicine or you use some of these like LIP 52 and kind of things. But even then, the large stores of knowledge and manpower of this system continues to remain unused. Now, the public sector can play a very important role. But as I said earlier, in the even Ayush ministry is not taking that bold step. And even the Ayush industry, the Ayurvedic industry or Unani industry or even homeopathic industry and Siddha industry, they are again following the pattern of allopathy. For example, an Ayurvedic medicine of diabetes will contain all the possible medicinal plants used in diabetes. They are not bothered whether it's a Vata-based diabetes or Kapha-based diabetes or Pitta-based diabetes. Whereas when you go to a Vaidya, the Vaidya will first check your Prakriti, whether you are Vata or Pitta or Kapha predominant, and accordingly suggest a medicine to you. But the company's product which is in the market contains everything. So they follow the same pattern. Because the Ayush or the traditional knowledge based industry cannot be normally commercialized and promoted in the market. So they follow the Western path again. But the public sector must focus. However, as I said, public sector itself was also not focusing. So we tried to look at what we should do. A small group of our associates with the Mission Samriddhi, we believe that Indian health paradigm uh, promotes family. At the family level, you can do, or at the community level, you can work for primary health care by empowering them to manage their routine health problems with the basis of nutritional management or medicinal plants resources that are available within the community. So we launched in 2021 a program called Mission Ayush Arogyakar. That with Ayush, we will make people Arogyakar program. They should remain healthy. That was the focus in primary health care. So what we did, we contacted about 11 voluntary organizations which are working at grassroots in UP, and we had a discussion with them. This is the webinar that we conducted. And initially, all showed interest, but then later only 8 groups took interest, and we had an approach where the work will be handled by the local grassroots organization, because we will not go, we cannot go to all the places. So we will provide guidance, the basic material, but the handling has to be by the local grassroots organizations. And we got very good results, based on which we expanded it to all India in 7 districts in 2024. What were the objectives? The objective was to promote awareness in these selected villages, initially in UP, about the nutrition and lifestyle, including yoga and everything, by making them self-reliant in managing their primary routine health problems, and also help them in identifying the public and private healthcare facilities. Like there are some Ayush hospitals or dispensaries of Ayurveda, Unani, Siddha, homeopathy in their around in their locality, and how they can approach them and get benefit from them. So the actual plan for holistic health objective was healthy food and lifestyle, then awareness. We conducted some webinars for making people aware, and B, we had identified, we trained at least 2 health volunteers from each village. They were called Ayu Mitras. So they were given a training on how to use our material, which we provided through posters and banners and a lot of other IC material, which I'll be talking about, and provided some medicinal plants to be given to each family. But this was based on the initial health survey done in the entire village. Only those families who showed interest in participating in the program, so they filled up the survey forms, they were given the plants, and 11 plants were given to each family, and every village or a group of villages, if they were very near each other, a community health garden was set up where something like 25 medicinal plants were provided. I'll give all the details in a little while, and provide linkages with the Ayush hospital dispensaries nearby, and develop this by training these workers who will also go to the community, let's say in a herbal garden, in a family garden, or where a group of family garden people will come, and they will conduct these household sessions in the community, and we will do this. So the cluster of villages at the district level was taken, and I said the volunteers were trained. There were periodic online Ayush Chopals, where Ayush Chopal, they will talk about maybe one plant or a group of plants, or how to use a set of plants in a particular disease. But otherwise, there were periodical or monthly webinars like this webinar on a disease condition, or let's say Ritucharya, the 6 seasons, and such activities for management of a particular disease like cough, cold, fever, or some other disease that one can talk about. But we are not talking about complicated or high-end diseases like tuberculosis or cancer and so on. We would largely talk about the primary healthcare problems, because this is all in rural areas. And we would say, use this knowledge for a while, for maybe a week or 10 days. If you are getting positive results, continue, get well. But if you are not getting positive results, go and approach a physician, whether a physician of Ayush or an allopathy, we don't mind. But don't keep sticking to a medicinal plant or yogic exercise, whether you are not getting benefit or not, because we would not like people to become more serious. So this, and then we would organize health camps in each community with the help of, there's a program of Ayush Mantralaya called Ayush Aapke Dwar, where these communities will invite the dispensary people. They will come with their medicines, and some medicines we will carry, and even the local folk practitioners of that area will be invited, and they will bring the plants which they use locally, which may be part of these 11 or 25, or which may be even beyond. So the knowledge of the local people was also encouraged to be used. So that was the approach we followed, and so that's how it. We did family survey, then we did herbal gardens at the family level, at the nutritional garden. We called it a Sehat Bagichi. Then we had capacity building of the nodal. We had a nodal officer appointed for one district by the grassroots organization, who was paid a little honorarium, and the Ayu Mitras and the community awareness, and through the webinars and the household practice. Then they used it and they documented it. And then when they documented it, we conducted a second survey called a follow-up survey of what they were told in the first survey. Like if they were using lot of a very large percentage people for little problem, they will go to a private shop, a medicine shop, take some medicine, or go to an allopathic physician, or go to a Jhola Chap doctor and take allopathic medicine. But how they changed over the period, that their community impact was their family health status improved by using these things, and family health survey showed that they had a much better health awareness and access, and they became largely self-reliant by not using medicines. So their budget of health care, primary health care, also reduced. Like if a family was spending some 40,000-50,000 rupees on treating a patient in the family in the last 6 months or 1 year, it was reduced to $5,000 by using the medicinal plants as well as nutritional plants, the good food diet, green vegetables, leafy vegetables, and so on. And if we show you the implementation footprint, in the first phase in UP, we had at Shahjahanpur, in Kanpur Dehat, Hardoi, Prayagraj, Barabanki, Lucknow, Sonbhadra, and Ayodhya. When we expanded to national level in the second phase, it was in Assam, in Betul in Madhya Pradesh, Jhansi, Faridkot, Punjab, Yavatmal, Maharashtra, and Wardha in Maharashtra. Kanpur followed even the second also. We had a total of 3,650 families covered, and second phase 27,441. Now, remember, this is the first time a study was done with data. We were not talking, generally it helps, people like it, people use it, people remain healthy. How many people were given, what they used, how much was the impact, all based on data. And as I was telling you earlier, these were the 11 plants which we gave to people, like Tulsi, Kalmeg, or Chiraita, they call it Ajwain Patta, Giloy, Grit Kumari or Aloe Vera, Manduk Parni, Jorankush, Pipali, Brahmi, Adrak or Ginger and Shatavar. And in the community garden, which is having some more, which you don't need daily, you need occasionally. There were things like Tulsi, Kalmek, of course, all these 11 were there. But beyond these, like Lajvanti or Mimosa pudica, Sarpgandha, Ashwagandha, Vacha, Punarnava, Nirgundi, Kadi Patta, Mehndi. Kari Patta, everybody has own. Mehndi also, Gudhal or hibiscus, Adusa, Sahijan, Moringa, Ajwain, Amla, Parijat and Harjod. So this is how we did, and we provided them the information about how to plant them, when to water them, so that they can maintain at home as well as community garden and make a nursery. And these are some of the pictures of, this is a family garden in Jhansi and Barabanki, Jhansi and Barabanki. This is a community garden. Those are family garden pictures. This is a community garden picture. We got some placards made and provided them. And then we, of course, had this kind of information about, no, let me, sorry, go. So this kind of webinars were done on, for example, on aloe vera or on this Sharad Ritu. नहीं आयुष है तो सेहत है. If you are using Ayush, you are healthy. So there'll be a Ayurvedic physician, there'll be a homeopathic physician, there'll be a Unani physician, there'll be a yoga physician, yogic expert. So all of these were invited. And in the health camps, for example, here, you can see a lot of people go for the health camp. This is the garden that you see with all the placards, so people can come and see it and use it. And they even take plants from there, from the nursery that they maintain. And this is how the health workers will conduct awareness programs in the community. They will go to a garden and invite neighborhood garden families and explain to them to solve their problems. And our experts sometimes also will go there and local awareness meeting. This is in Assam and in Punjab and like that. All over these programs were conducted. Then, of course, all this material about, we have a magazine which is both in Hindi and English. And then there are these YouTube posts like Sardiyon ke Pakwan. Most of the material is in Hindi because we focus in the Hindi belt. And even Assam managed in Hindi, some of the Punjab. But many of these places, they have translated our material into their local languages, like Gurumukhi and in Marathi and so on. And this community IEC material has been used like that. This is interesting. When people were using, they were using for which disease condition, which herbs. These people themselves have shared and we have compiled that knowledge. So the program reach was about 43,000, 44,000 people were directly benefited in the records. For each of these, many more people nearby, they also use it. We have not recorded them because they are not part of the data that we have. So actually, more than 70, 80,000 people have benefited. But this is based on the data that we are talking about. And then we also got some very interesting stories, case studies. Like this person was having these rashes in their palm and the foot sole. And in one of the discussions, our physician and local physician told about some plants. They used that and they became correct from this condition to this condition. See the difference. Then somebody was using in anemia what plants could be useful. Now this child was having childhood anemia, which is called sickle cell anemia. They have to get blood transfusion every month or even more frequently. They used the same thing and the nutrition, and the childhood anemia was largely controlled. Now this girl was not required to go to get their blood infused every month or every 15 days. Even 3 months, she didn't go for a blood, and her hemoglobin improved from 4 or 5 to something like 8 or 9. See, critical 3.3 gram per deciliter, the hemoglobin improved to 9. Yeah, 8.5 to 9. So that was, even our own volunteers documented these cases. We were largely working on primary health, but even in specific conditions, these case studies came. And this is the gross data that we are kind of sharing very quickly with you. This is the first phase, 8 areas. These were the total families in red. How many families initial survey and the follow-up surveys in blue? How many people were sick? In the initial survey, 1,864 became sick in the last 6 months, which reduced in the next 6 months. Here, allopathy, they were using 800 people were going to, they recorded. I mean, everybody did not respond. And second phase, only 150 people were going to allopath. That was a drop in going to an allopathic physician. In Ayurveda, from 148 to 303. In homeopathy, from 172 to 4. Unani, 2 to 1. Jadi Booty, 354 to 768. Using locally medicinal plants. Earlier, 354 people were using in the primary survey. Follow-up survey, 6 months later, 788 people using. So that is the impact you can see of the use of this knowledge, awareness, health camps, and the entire program. And this is in the 7 clusters in the second phase, where 2,741 families, and similar data. Sick member reduced from 3,900 to 1,600. Allopathy used from 2,600 is reduced to 271. Like that, and Ayurveda increased. Homeopathy, again, not increased. But Jadi Booty increased. Yoga increased. Only 228 people were doing yoga. Here, 1,634 people were doing yoga after the second survey. So that is the impact. Based on data we are talking about, we are not talking about general impression and general hearsay. So the key messages are the community ownership of the facilities, practical knowledge, using local resources, and a scale for sustainability. And what we are now trying is that we are moving out from this group, saying, now you take care. So we have identified local people who are going to manage with the community. No more support, no more help. We will only provide some community awareness through the webinars where they can join, where earlier also they were joined. So I'll stop here, and if you have questions, you're most welcome. Thank you so much.
Thank you, Narendraji, for a very...
I've tried to be as precise as possible.
Thank you for a very nice and scientific presentation. And not only that, normally NGO doesn't have proper documentation. But having a science background and having worked with so many organizations, I'm happy that you could motivate all the members to be more scientific and collect the data properly and present it very nicely. Now I request our colleague Dr. Sanjay Banerjee to coordinate question answer session. Over to Sanjay ji.
Thank you very much, Dr. Mehrotra ji. It was a wonderful presentation, and there are several challenges that you have at least been partially able to overcome successfully and created data and all that. And now I request the members to kindly raise their hands. Nisha Govindji, your hand is raised right from the beginning. Do you want to say something, or will you down your and Isha Govind. Okay, we move on to the other persons. Kindly raise your hands and pose questions to Dr. Mehrotra.
Thank you, Vasudevji. So thank you for the presentation, sir. Actually, my question is, okay, so you told about 11 plants that we can grow herbal in the herbal gardens, but say if we are not in a position to grow 11, or even say in cities typically, um, the maximum we can go 2-3 plants, or in that case, is there a way to have any of these plants as a like say in any of the Ayush pharmacies, will we be able to get the plant equivalent nutrients through some or the other means?
Yeah, let me explain. Almost all the 11 plants that I have suggested for the family garden, they can also be grown in pots. So you don't have to grow in the field. Even in your own pots, even in flats, you can grow them. If even that is not possible, you have to look for some places nearby where they can be. They are also normally found locally all over, or similar plants. You can get their equivalents. I can share the pamphlet that is we have made. It's in English, Hindi, but we'll try and get an English translation for you. And Vasudevji will be able to suggest the places where it can be available. Dispensaries supposed to have it, set up gardens, but most places they are not set up. We can encourage people to set up these community gardens, which we have suggested 25, and even local plants, the equivalent of what is mentioned here. Locally, they may be a slightly different plant, because in our concept, traditionally I have mentioned in the slide, but I forgot to speak about it. They talk about using a locally available plant. What's called yad deshe yasmin jara tad deshe tadaushadam. Wherever there's a disease, in that location you will also find a plant to cure it. So use a local plant, which also helps you in maintain diversity, biodiversity. So that one should try. So you will get them. They are not very complicated plants.
Yeah, I agree, sir. See, in fact, I mean, I am growing, say, like 4 or 5 plants out of the ones that you said. But in general, I am just asking if a person is in the city.
Sure,
And then, yeah.
You can get them from anywhere, or in a park nearby. What you can do is, through a community health, you can have some corner for medicinal plants, which could be grown there, and people could be encouraged to. I go to a park nearby. I've tried to help them develop. Even trees, I have encouraged them to grow the medicinal trees, quite a few of them. So people do use it, and it's working.
Valyapriti
Yeah.
and Narendraji, you will be happy to know that in Nagarkoil there is one M.S. Hassan. He has a roaring business.
Yeah, yeah.
Hundreds of plants he is selling, and now people are doing online payment. Otherwise, earlier he used to carry money
Yeah.
in the gunny bag for depositing in the bank.
Yeah, yeah.
As you rightly said, that luckily in Kerala and Tamil Nadu, knowledge of this herbal medicine is very much there, and
Yeah.
fortunately people are still using that.
Yeah, yeah. Because that survey showed
Yeah.
that even in Tamil Nadu and Kerala, where the allopathic system is equally strong,
Yeah.
the facilities are strong. But even then, people go to the traditional medicine fellow for treatment for many situations. That survey showed, data wise.
Yeah, any other
Yeah,
questions?
thank you.
Yeah, Raghunandan ji, please carry on.
Namaste Mehrotra ji. You remind me of a person with whom we are in contact. Probably Vasudev ji will know. Dr. Jamwal from Jammu.
Yeah.
You see, he was a medically trained doctor. It seems
Yeah.
he was posted. It was before independence. He was posted to Gilgit, and then when he saw the people there, there was no use for his knowledge at all because everybody was very healthy. And then in Gilgit area, they used to eat dried fruit and local medicine. There was nothing like illness there. And people used to live for a healthy life about 85, 90 years old, very, very
Yes.
happily. So what he did was, after coming back from his engagement there, he joined RRA, Regional Research Laboratory, to tell about bring awareness about medicines, allopathic medicines, which are harmful. And he started practicing allopathy, nearly, I think, naturopathy. He lived up to 89 years, and
Yeah.
actually he didn't pass away because of any illness. He had a fall because of that. So it's very right that it's really wonderful that you have taken up this campaigning of Ayush medicines, local medicines. And you were right in saying, in Kerala, though these multi-speciality hospitals are there, the general mass of people practice Ayurveda, and Ayurveda is very strong here. And
Yeah.
every person who is probably more than 50 years or 60 years old, he goes to the hospital not because he is ill, but because he wants to know whether his BP is normal, whether his sugar is normal. So for finding out whether there is anything wrong, so that he can take steps, and he takes steps through Ayurveda or local medicines. It was really, really wonderful, and I appreciate. I remember, you see, in China they say, not the present day China, the ancient China, the king used to appoint doctors in villages. The beauty of that assignment was, he should see that nobody falls ill in that village,
Precisely.
and the villagers will take care of the doctor for all his subsistence and looking after. And in case somebody falls ill, so those people will stop giving him the rations. So that's how it used to run. So you started with that. People, I mean, the hospitals talk about illness, whereas actually we should talk about health, more of health. And you rightly said about the Rugnalaya. It was really very nice. Thank you so much.
Over to others.
Yeah, now Prakash Chandraji, Maithani ji, please carry on.
Pranam, Dr. Mehrotra ji. It was really indeed a great presentation and very well knit against the experiments as well as the field trials. I have a basic fundamental point to speak here. Question is that any invention in the medical field, whether it can be used in an integrated manner or not. Dr. Mehrotra ji, thank you very much for a very, very nice presentation, and a lot of insights were there. I have a basic point that why are we promoting separate streams in the country if there is a medical system? Ayurveda is there. That time it was the most modern when it was invented, and still invention is going on. And there are another pathies like allopathy and others. It is a modern science, and it is being developed. Is there any way where the both can be integrated in a way that where we can see that what best for the person and what best for the country? It is not the question of that 95% to this and 5% to this. It is not this or that. It is that whether what is the best possible solution for the person. Nobody doubts that, particularly in the areas, in remote areas, when I see that people, most of the ailments they try to treat themselves. खांसी जुकाम हो गया तो वो बसा ले लिया, या अडूसा जिसे कहते हैं, tulsi, ginger, everything is being used in the households in very common way. They will never restore to the antibiotics and other till it becomes really something very serious and they cannot handle it at their own. So now question is that in the education system itself, wherever we are developing this so many doctors from the different pathies, can India look for an integrated way whereby we can work on each and every pathy strengths?
You are right. In fact, the government of India, the Niti Ayog, had taken an initiative whereby they have proposed that there should be an integrative healthcare system where all pathies could be integrated for treating or for managing health. So there is a proposal, but unfortunately, there are politics of the industry which would not like it to happen, because industry doesn't want people to be healthy. The industry will grow only when people are sick. So, as while I was at All India Institute, even then I used to say, and when I learnt it, that healthcare today has become an industry. It's not a health system. The hospital is an industry, medical education, medical colleges are an industry, dispensaries are an industry, pharmacy are an industry, diagnostic is an industry. Everybody wants, they want more tests to be done so that more commission, more expenses, more health insurance is an industry. So the entire healthcare system has become an industry. And industry doesn't want people to be healthy. They want people to be sick so that the industry grows. And that is the first level of fight our people in general have to raise it. And the politicians have to understand it.
Pranam, sorry, I'm coming again just because one thing more in my mind. Because you are from CDRI and you have seen the growth of the medicinal herbs, how they are being treated and how they are being developed in the modern system. I specifically remember once there was an invention at the CDRI about the Brahmi. And I remember in my childhood days, we used to eat Brahmi from our fields, and it gives us a very good feeling that the medicines were developed. Now I have seen many of the allopathic practitioners have been prescribing Ayurvedic medicines, but you rightly mentioned that the system does not take into consideration the basic nature of the patient. So in this, what is your take on that? Because the kind of medicines are in the market for Ayurveda, they are very cheap also and very costly also. People have been resorting to these treatments in a big way. So ultimately, it is not an excuse that they are being industry or anything. Question is that what is the best for the country? That has to be seen in that perspective only. So I thought I shall mention this. Thank
So
you.
there are two things. One is the aspect of industry that I'm talking about. The other thing you mentioned about uh, developing a medicine, let's say from Brahmi. Not only Brahmi, CDRI worked on several medicinal plants, and they promoted medicines developed from there. So that's how it is going on. They would also like institutions like CDRI would like to have a, product developed, because then they can sponsor it to a company, and that company will give royalty or some consultancy money to the institution. That's the institution survival and prestige and all. What I'm saying is the entire system is based on promoting industry in one way or the other, which is the unfortunate part. And that has to be changed, which is what is important. And when we are talking about Ayurveda, I mentioned in one of the slides that Ayurveda or traditional medicine cannot be commercialized. The moment it is commercialized, it doesn't remain the basic fundamental Ayurveda. So, on one hand, maintaining the sanctity of the system, on the other hand, for community, where it has to be things like an integrative system, but integrative system should be by giving equal importance and prestige to each other, not that the allopathy will people will dominate. I'll digress for a minute to give you an example. I was asked to prepare the 5-year plan of UP government for health sector, and I suggested to them to set up a health university at that time in 97. But I made a suggestion that the vice chancellor of a university will be by rotation. For 2 years or 3 years, you keep an allopathy person. After 3 years, an Ayurveda person. After 3 years, a Unani person. After 3 years, a yoga person. After 3 years, a homeopathy person. They agreed for the university, but they didn't want this rotation. They said these people know nothing. The vice chancellor has to be from the allopathy only. So, of course, I won't go into the detail of that story, what happened eventually. But what I'm telling you is their approach to dominance and the lack of confidence of our traditional people, Ayurveda and all, is responsible for the present state of affairs, which was different in China. That is why China today, in their own country, every hospital of China has a Chinese medicine department also, and with equal importance. In fact, OPD, when you go to a Chinese hospital, the OPD, when you go and tell this is the disease I am facing, they will say you go to a Chinese medicine or to an allopathic medicine. You cannot go to allopathic all the time. You have to go to Chinese where allopathy is not important. That's by rule. Of course, diagnostic testing is a common. And this they started some 40, 50 years back. And that's how the traditional Chinese market is the highest in the world in traditional medicine. And only Chinese traditional medicine is recognized globally. Ayurveda, etc., are not recognized globally, neither by WHO or others. Only selected recognition is there. Sorry, I
Thank you.
diverted, but I thought I'll give you an overall picture.
No. Thank you very much. Now I request Jagdish ji to have his say. Because
Yeah.
Raghunandan ji will come back.
Yeah, Namaste, Narendra ji, for your wonderful presentation. I was now listening to the conversation between you and Prakash ji, and I agree with you that instead of commercializing the Ayurvedic medicines, more need is to validate it scientifically and have equal importance with with the allopathic practices and medicines. And that was a very nice way you sum it up that discussion. My question is, is modern molecular science research is applied to Ayurvedic formulations? Because if you go to the molecular level, the effect of the medicine is much more. So whether that thing is being applied to Ayurvedic formulations also.
You see, there is nothing against it, but it has to be understanding the theoretical framework or paradigm of the traditional system. If you are doing research on, let us say, an Ayurvedic herb or a Siddha herb or a Unani herb, there are two ways of doing it. One is by doing a reductionist approach and trying to find out the active principle in this. For example, I'll give you Reserpine, the example of Sarpagandha. Way back in 60s, Sarpagandha was the first medicinal plant which was studied thoroughly to find out that it is useful in reducing blood pressure through reduction of anxiety. But when they isolated the compound, which is Reserpine, and they marketed a tablet of Reserpine, the tablet of Reserpine had side effects. The whole Sarpagandha tablet prepared by Ayurveda had no side effects, but Reserpine had side effects. So it was withdrawn from the market. The company went back to study why it had side effects. So they spent another several crores that time, several hundred crores, to find out what other compounds were responsible for side effects. So remove that. Now you can keep doing research, spend crores of rupees to find out which compound should be used and which compound should not be used. But what is wrong in using the Ayurvedic preparation of the Sarbanda tablet, which is much simpler. So research should be, and let me give you an example of that also. In rheumatoid arthritis, the Ayurveda pharmacy Coimbatore was given a project. Initially, they accepted, they didn't want to do it that way. The NIH and WHO and many people funded them to prove that which Ayurvedic medicine is good in rheumatoid arthritis. They said, we cannot pinpoint a particular medicine, but then they said, WHO people said, no, it has to be one medicine. You can't try so many of them. They somehow agreed. They couldn't find anything, so the project was failed. 20 years later, they again discussed, and this time an NIH lab was involved, an allopathic university medical college from US was involved, and the Ayurveda pharmacy and Ramanohar from the Amrita Institute were involved. And they did a joint study of studying something like 8 or 10 medicines which could be used, not one medicine. The study was whether Ayurveda can be used versus the best medicine available in allopathy, which is methotrexate. So methotrexate was the positive standard that if a patient is not improving, give methotrexate. The best result will be from methotrexate. If it is to be comparative, double-blind, placebo control, Ayurveda, it will be not one medicine. The Vaidya will decide in this condition, this medicine, after 1 week, second medicine, after 2 weeks, third medicine. He could use any of those medicines, but it will be double-blind. The physician will not know who's the patient. The patient will not know who's giving the medicine. All double-blind controls. And the result showed, and I'm quoting the heading of the research paper which was published in American Journal of Rheumatology, which said Ayurvedic treatment is as good, if not better, than the best medicine in allopathy, that is methotrexate, because it has no side effects, whereas methotrexate has side effects. That paper was published. Further studies on that paper have not been conducted. Now, Ayurveda department should fund that project, spend 100 crores if necessary, but they will not give them even 5 crores to conduct that study further. How will you develop a product further? That study was a initial pilot study. On finally, they started with 100 patients. Only 30 patients could continue in the protocol that was followed. So it was treated as a pilot study. From a pilot study, you have to go to a full-fledged study which should use thousands of patients. That is not done. Why is it not done? Again, because the allopathic people will not allow, and our Ayurvedic people will also have no confidence to support it. That is the issue. I hope I have made it clear.
Yes,
Yeah,
that was a very good explanation. Yeah. I want to further just comment that we were very much impressed with your, this system of biogardens for families and communities for homegrown, because, you become what you eat. And the recent, the problems which are going in Maharashtra, and that the Tukaram Munde is carrying out, raids on the adulteration on many restaurants and many other, food outlets. So it is becoming more and more important that if we have our own family gardens, whatever as much possible in the gallery or whatever space available, and there, if we can get guidance from Ayush and the booklet, we are really looking forward to the booklet which you talked about in the Hindi version as well as English version. So
I
this
share it with Vasudev, we get
Yes.
English, no problem.
Yes. So this, I think, is a very good thing which is happening, and we welcome it. Thank you very much.
something.
Just a comment. As you rightly said, in China, the local medicine is being promoted. in Kerala, most of these specialty hospitals also have all these departments. They have Ayurveda, they have homeopathy, they have, I think, Unani also. So there is still hope that basically the Ayurveda and the local medicine should be accepted by the people. When it becomes acceptable, I think it will be nice. Thank you so much. I just wanted to say that. Thank you.
Your session was wonderful, sir. My question is what are the daily routine practices so we can keep to ourselves healthy?
That's a long answer question.
Yes, sir.
That will take a session itself.
Okay,
You
sir.
can consult a local Ayurvedic or Siddha physician who will
Yes,
probably
sir.
guide you on that.
Yes, sir.
The
Okay, sir.
question is
Thank.
very pertinent, but it needs a long answer.
Okay, sir.
At the fag end, it's not probably possible.
Okay, sir.
Yeah, Narendra, I would like to make an observation. You are right. Actually, these Ayush medicines cannot be commercialized. I remember
Yeah.
when we started the Siddha system of medicine 40 years back in Kanyakumari, I was also very critical of our Siddha doctors, and I say you people don't know how to standardize that typical reductionist approach. At that time,
Yeah.
when Dr. Chaturvedi, from a very famous Ayurvedic doctor, came from Mumbai, and I was again repeating same thing. I was seeing as if have discovered something. Then he didn't say that I am a fool, but very nicely he said, Vasudev, there are 120 crore Indians. Not a single Indian is same like other. Every one of us are different. So how the medicine can be standardized? Where every person, there should be a separate medicine and the Ayurvedic
Absolutely.
doctor knows about it. And
Absolutely.
as you rightly said, even Vata Pitta Kapha, there also there will be some again sub divisions. And only physician knows about it. Since then, I kept my mouth shut. Otherwise, all the time I was very critical. And not only that, at that time also he told, now the modern medicine, now they are saying about genetics mapping. Now the
Yeah.
allopathic fellows have started coming to Ayurveda. And that
Yeah.
every one of us are separate, and that's why the medicine should be separate. Maybe in another few years, allopathy will start following the system of Ayurveda. I am really very happy. Thanks to you for a wonderful presentation. I hope you will come again for some other topic and also suggest some of your own colleagues who will come for this webinar. Thank you very much.
लोकाः समस्ताः सुखिनो भवन्तु लोकाः समस्ताः सुखिनो भवन्तु लोकाः समस्ताः सुखिनो भवन्तु ॐ शान्तिः 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 ॐ श्रीगुरुभ्यो नमः हरिः ॐ